in terms of cost effectiveness and value for money and return to the population as a whole. There is no more effective health intervention than vaccination. They are safe, they are relatively cheap, and they produce a return on that investment through prevention of disease, which is many, many times greater than what the cost of the actual vaccination is. VIRGo does research which focuses on clinical trials and evaluations of new vaccines in healthy babies, children, adolescents and even adults. VIRGo's been doing clinical research in vaccines for nearly 25 years now. There's a collaboration between the Murdoch Children's Research Institute and Royal Children's Hospital, and that collaboration between the University of Melbourne's School of Population and Global Health is an important way in which we've actually made this work. So it's been a very powerful and a very productive collaboration over a number of years. In Australia, that information is used to make decisions that governments need to about whether to publicly fund vaccines to go onto national immunisation programs, for example. It's also used to guide clinicians in how vaccines are used, what schedules are used, how frequent boosters are required, those sorts of things. It feeds then into national policies that end up in immunisation handbooks that are used by doctors, nurses and others in the community. And it also provides information that is the basis for public information, to provide consumer information in a digestible lay form that families can understand in making informed decisions about having their own children vaccinated.
The Vaccine Immunisation Research Group is looking at population epidemiology research, and that's looking at how well we are protecting people against certain vaccine preventable diseases. Home immunisation is just a fantastic way of engaging families and making them feel comfortable about immunisation.
It's so convenient and easy, and they were just so warm and friendly. That was just a really relaxed environment.
When a parent contacts us to suggest they would like to be involved in one of our clinical trials, our research nurses will have a chat to them on the phone and inform them a little bit more about the vaccine and just check whether their child is suitable and eligible to partake. The next step would be to set up a time where we come for our first visit. It's an immunisation nurse, a doctor, and sometimes if we're taking blood, that will be also a phlebotomist. We want to make sure that the mum, dad or guardian understands fully what's involved in the study and that they're happy to proceed, and then we go ahead with the study.
She was pretty good. She cried for 20-30 seconds and then was easily distracted and was fine for the rest of the day.
After the vaccine is given in the home, the VIRGo team stay around for around half an hour after the vaccines. Obviously there's lots to discuss. We talk about the vaccines and sometimes we ask the parents to fill in a diary card. One side effect of any vaccination can be anaphylaxis. We carry all the right equipment to treat anaphylaxis should that occur. It's a very rare event, but if it would occur, our study staff are fully trained to ensure the child is safe.
We monitored Clara's reactions and her health for a full month after the vaccine was given. I was able to call into the office and they'd be able to answer any concerns that they had.
Combination vaccines are particularly important for acceptability to families and also for improving the uptake of multiple vaccines. So for the comfort of the child or the baby, for the minimising the cost of reducing the number of visits and so forth, there are very good reasons for having these combinations.
At VIRGo, we're looking at giving a combination vaccine against meningococcal A, C, W and Y, and that has the benefit of providing protection to 4 different types of meningococcal disease. So that is one vaccine clinical trial that we're doing at the moment.
The social research that I started within VIRGo is essentially around vaccine hesitancy or parents' concerns around vaccination. Parents have so much more access to social media and the internet now, and they're going on and reading a lot of information from a lot of sources that are not necessarily trusted sources of information, and so they're getting very conflicting information. So to assist healthcare professionals to have conversations with vaccine hesitant parents, we want to provide them with the skills to communicate better with families, to be able to give them time to express their concerns and to develop trust, but also to provide them with simple resources that they can give information to families in an easily sort of digestible way.